I'm Melissa. I'm a speech-language pathologist at the Niagara Falls Hospital site. We complete bedside swallowing assessments. We complete video fluoroscopic swallowing assessments. That's a huge piece of our outpatient program that we do that provides an x-ray swallow for patients in the community so they can tell if they're safely swallowing. The role of the SLP within the hospital setting, acute, chronic, and outpatients across Niagara Health is that we work as a multidisciplinary team. We have a very large component of swallowing involved in our jobs, and it's very different than what you would see in the community. Community-based SLPs work a lot with communication, don't do as much with swallowing, and it's an integral piece to our job. I think it's very important for people to understand that SLPs have a role with swallowing and as well with communication, and that we're here to try and make meaningful outcomes for our patients. The age of a patient actually, I don't think impacts a patient's outcomes as much as what the severity of a patient's diagnosis is and what their status is medically. When you are 80 and come in and suffer from a stroke, you can have the same recovery that you can when you're 50 and come in from a stroke. It just is so dependent on the severity of that stroke and how motivated you are for rehab and for trying to improve.
Completing my undergraduate degree, I began volunteering in a hospital setting and was introduced to the rehabilitation department. I had the opportunity to observe speech-language pathologists in action, and I witnessed the meaningful and positive impact that their work had on patients' lives. This is what initially ignited my passion for the field, and I decided to pursue my master's degree in speech-language pathology. Much of what we do as speech-language pathologists in acute care medical setting involve assessing and treating dysphagia or difficulty swallowing. We complete clinical bedside swallowing assessments and may recommend diet texture modifications and treatments, including swallowing exercises or compensatory swallowing strategies. Niagara Health St. Catharines site offers inpatient services for patients who are currently admitted to the hospital, as well as outpatient video fluoroscopic swallowing assessments for individuals from the community who have been referred by a physician. Patient goals and treatment plans are individualized and created based on our findings from assessment and in collaboration with the patient and family, depending on what is most meaningful or functional for that particular patient to target in therapy. So specific treatment techniques: if a patient presents to the hospital with dysarthria or slurred speech, and we're working on improving the clarity of their speech, therapy may focus on breath support for speech, slowing down the rate of their speech, breaking the words down into smaller parts, and exaggerating the sounds in the words, first in structured therapy tasks, and then incorporating these techniques into their daily interactions. At Niagara Health, we have speech-language pathologists who offer services at all of our sites, including the St. Catharines site, Welland Hospital site, Greater Niagara General site, Port Colborne site, and Douglas Memorial site in Fort Erie.